Welcome. This is Jason Clemmons, Doctor of Chiropractic at the Rock Health and Wellness Center, and this is Life with Jason Clemmons, DC. This is Thursday, September 19th, and we're live just like always from the Rock Health and Wellness Center studios, and we're on 98.7 Walk by Faith, 1420 AM Lubbock Christian Nation, and all over social media. All over, just all over the entire planet. That's what we're doing tonight. Hope you guys had a great day. It's been great at the Rock. You know, it's so fun to say that every single day. I say that every night, right? I've been saying it over a year and a month now. We're almost 13 months through this thing. And it's so cool to be able to come to work. I told somebody today or yesterday, I can't remember, I said, you know, it's not my fault I'm the most spoiled, rotten guy in town. It's like somebody's got to be. And so it's pretty awesome to be that guy, at least be in the running for it. I don't know who's winning, but at least somebody's, you know, there's got to be somebody that's the most spoiled, rotten guy in town. And I don't know how they must have it really dang good to be more spoiled, rotten than I am. So, yeah, blessed. Some people say blessed. It's ridiculous what we get to do. And it's great. It was a great day. It was, man, it started this morning at 6 with working out and just went all the way through, had a new patient at lunch. I'm going to talk about that a little bit tonight on the show. And then just did adjustments until we walked in here and started the radio. So now I get to talk to you guys for an hour. And we're not even going to study tonight. So it's going to be a little bit more exciting than it was last night, I hope. At least Susan told me that this morning. She said, hey, I enjoyed your show last night. So cool. You never know. You know, it's like, look, we do a lot of content. That's 5 nights a week is a lot of stuff, right? And it takes up time. It's, you know, if you think about it, it's probably 10 hours a week out of my time, at least, of trying to prepare for the show, trying to think about what we're going to do and do the show and all that sort of thing. Maybe 15, maybe not that many hours, maybe 8 hours. But it just sometimes it's time. So there's times like yesterday, I just got something on my mind. And hang on, let me see. I'm getting some comments here. Oh, good. Sometimes I just got things on my mind, and I don't want to. I just want to stick with it. I just want to stick with it and study it, and that's what we did last night. It's probably boring for you guys, but maybe not. Maybe it was a little bit interesting to try to you know. I don't know if that's what you guys do. Susan said it's kind of what she does when she's looking up something. It's like, to me, you know, one of the things that happened when I was in chiropractic school is I was a little intimidated at the very beginning because there were so many words that I didn't understand. And people that are in the business, they just spout them off like everybody knows what they mean. I probably do that a lot on the show. I probably say things that you guys hear for the first time, and you're like, I don't know, I don't even know what that means, which is fair. And I try to be as simple as possible. And I got some criticism in the beginning of the show. It's like, you don't sound credible. You're not very smart, whatever. And I'm like, well, that's fair. I mean, like I'm not worried about that. I'm not worried about criticism, right? Like, it's like, fine. Like, I played quarterback my whole life. Like, I've had criticism before, and I'm a chiropractor, for goodness sakes. That coach said New Mexico State, I lost to North Texas. Are you kidding me? Like, don't tell me about criticism. Like, I can handle that, which is fine with me. Like, it's good. Like, if there's haters out there, let them hate. That'll be fantastic. That's totally fine. But I had to get some foundation underneath me to try to understand it. And I had to sit there. I remember sitting there in the library trying to say, okay, look, there's only 26 letters in the alphabet, and I know all 26 of those letters. I literally said that to myself, sitting in there, had my book open in front of me, and I just said that to myself. I'm like, look, dude, there's 26 letters. You know, it starts at A, ends with Z. You guys know it. You sang the song when you were little. You know the same letters, right? So they're not going to trick me with a word. I may not be able to pronounce the word. I may not be, especially with, you know, I got me some new glasses today. I'll talk about that in a second. But sometimes your brain doesn't work right. And sometimes you're fatigued and all that stuff. But And sometimes you just don't know the word. And it's like, okay, what am I going to do? Like, what am I going to do if I don't know the word? Am I just going to not say it on the radio? Am I just going to skip the whole paragraph? Am I just going to pretend like I know the word and then not, you know, it's like, look, I got too much riding on this thing. There's too many of y'all that are dependent on me to try to do as good as I can do. And I'm dependent on myself to do as good as I can do. So I just have to like last night, I just have to open up a window and type in something. And it's like, dude, you should have known that from the very beginning. You're right. I should have. Maybe I did. Maybe I forgot it. Maybe I hadn't thought about it in 20 years since the last time I got it. Maybe I didn't really learn it the first time. Who cares? Like, what difference does it make? Whatever excuse is, it's just like, look, just type it in, learn it. Take that sentence and highlight that sentence and then open a new tab and then punch that sentence in there and then go and then see what that says. And then you'll read another paragraph and then you'll read something else and like, what is this? And what is this? And how does this fit? And then, wait a minute, where did that come from? And how does this thing go? And that's the way I study and learn. I know some stuff. Some stuff. I don't know all the stuff, but I know some of the stuff. And I personally think I'm not that strange. I think that a lot of y'all are the same way. There's a lot of things that whatever it is that you do for a living, whatever it is that you did do for a living, if you're retired, whatever you're talking about out there, there's some things that like, in depth, your business, whatever you did. If you're a teacher, teaching. If you were a carpenter, carpentry. If you were a bus driver, bus drivers stuff. Like but maybe when all of a sudden we talk about something different, it's a little intimidating, or you get lost or whatever. And so I just wanted to study last night, and some of it sounded really, if I was analyzing it, some of it sounds really dumb, which is fine. I don't care. I'm not as dumb as I sound sometimes. Are y'all as dumb as you sound? Y'all don't say anything? Yeah, whatever. I don't care. Okay, so hey, update on the glasses, right? I got some new glasses. We talked about this. These glasses have been driving me nuts for 2 years. They mess up your brain. If you guys don't understand that, they mess up your brain. And if you really don't understand that, it is factual. And he told me what it was in the Pride of Love. I should have asked today while I was there, because but just remember that you got a right side and a left side brain. And if you guys think about how important this is, right side and left side brain. And we, our pathway, our favorite little up and to the right, over to the left pathway. Okay, attention right here. 4 out of 5 types of attention in the right brain. One of them is alertness, one of them is vigilance. It's right brain to left brain. Focused attention. Attention, 1 out of 5 on that left brain. And that's focused. And everything else. But you have to send it from right to left. And what these glasses do, if you guys are wearing glasses, what these glasses do, the lens of the glasses, and you guys that are over 45, that have bifocals or trifocals, what this lens does is it starts a progressive pattern that moves down the glasses. And as it moves down the glasses, it becomes it becomes stronger. So the strength increases as you move down the glasses. And so there's one little spot that's focused. And then everything above that line is your long distance viewing. And so when I look at you today, I can see that perfectly clear. But these glasses seem like it's like I got a shield on my face today. They're so much thicker. These glasses are so much thicker than the glasses that I've been wearing, because I was trying to create more space to work. I was trying to get a bigger whiteboard. I was trying to get a bigger canvas for the opticians to fix me a field of gaze that works. And when I look out there, it looks really good. Like I look out there and I'm fine. But now I've got all this extra glass around here, and looking down right now is it didn't solve anything. I can't tell that it solved anything. But what happens is it makes this blurry. It makes your peripheral vision blurry. And peripheral vision is your vigilance and your attention in your surroundings. It's your right hemisphere. It makes your right hemisphere blurry. Now you're trying to pass that information to the left and tell your brain what to remember. Remember the tip of the tongue phenomenon that we learned from Dr. McGilchrist? The tip of the tongue phenomenon is I just can't remember. I just can't remember. Hang on. It's right here. The name, I did it this week trying to remember Tyler Technologies here in town. I was trying to remember, I was talking to a person and I was trying to remember the name of that. And I got another word stuck in my head, and then I couldn't remember Tyler Technologies. And I was like, no, so-and-so works over there, whatever. And I was like, hang on, it's, and I said, just forget it. I'll text you in just a second when it comes to me. And what that hang on moment means is it means that your left hemisphere is trying too hard. This left hemisphere is trying too hard to remember what's going on, and it won't let your right hemisphere tell you what's going on. So it just stops it. The left is like, no, don't tell me, I got it. Don't tell me, I got it. Don't tell me, I got it. And your right hemisphere is just kind of sitting over there, just kind of like, okay, whenever you're ready. And then finally your left hemisphere will be like, okay. And what happens is you quit trying so hard, and then it just pops into your head. Where did it pop into your head from? It popped into your head from your right hemisphere. Your right hemisphere already knew the answer to the question. It was just trying to get it over to your left hemisphere so that you could know it. Now just imagine if your right hemisphere is blurry. Yeah, and he explained it to me. It's in the parietal lobe. So if we cut this in half and then we cut this in half, it's basically this section of the right hemisphere over here that's blurry. It's blurry from all this stuff. Yeah. It'll mess up your brain. It's a real thing. It's as real science as any other science that exists on the planet is this deal right here. And so these I tried to get these a thicker lens and a wider lens to let those guys because what my doc told me, he said we could widen this field out and make this thing wider and bring it out here so you have a wider vision and less blurriness. And I don't know. I can't, it's been blurry all day. And I got so much glass on my face right now that trying to drink something, my cup is hitting my glasses. I was trying to get to the bottom of that cup earlier, and I was tipping it up and I was bumping my glasses. And then I think I created some fog on the bottom of this one by sweating a little bit today while I was working. And so I don't know what's going to happen. I feel like I got safety goggles on or something. So we'll try it out. Dr. Riley's awesome. They're going to fix it for me. They'll work on it. But he said the next thing we got to do is just go straight line trifocals. So you're just going to have a line and a line, and then that kind of messes you up when you try to step off a curb. You look down and it's like, whoa, it just kind of jumps on you. So we'll see. Maybe my eyes will adjust to this a little bit, and we'll go from there. So that's the update on the glasses, and I hope to keep you guys updated and find out. I didn't have any idea. I was just wanted some cool looking glasses. So Leslie would think I was cute. That's the only thing. And so I got some that were thinner. I got some thinner glasses, and because of the thinner glasses, I didn't have enough whiteboard to work with. Let's see what JT's going to say here. Yeah. Yeah. You know dang well, JT, you get to be a certain age, you just want your wife to think you're cute. Like every once in a while, just especially when her love language is not words of affirmation. So you just kind of wish that every once in a while she'd say, "Hey, you look cute in those glasses." Yeah, that's what I told her today. When I put these on, she was analyzing them. She was analyzing how thick they were, and I said, "Look, I don't need you to analyze them. I just need you to look at me and say, 'Hey, you look cute in those glasses.'" And she was like, "You look cute in those glasses." I was like, "Thanks, that's good." I can't be the only guy I can't be the only guy, right? It sounds like I'm a sissy boy or something like that, but I can't be the only guy out there that just you know, wants his wife to think he's cute every once in a while. Maybe y'all are too busy or something. But anyway, let's get on with this show. I don't know what the heck happened to this show, but let's move along. We were talking about some serious stuff on Monday, and I thought we'd go back to it because this is really big news. Um, if you think about it, this is kind of big stuff right here. Um, let me see if I got the right. Yeah, this is a case report one right here, and we're gonna talk through this article because I didn't want to just kind of wash over it. Um, Pathoanatomical changes of the brachial plexus and of C5C6 following whiplash type injury, a case report. This comes from the Journal of Whiplash and Related Disorders, Volume 1, Number 1, 2002. And it doesn't really say, it's just a group of people. It doesn't say where, but one of my new patients this week was a college dance team member. She's been a dancer since she was a little girl, and she's a dance team member. And she came in and was complaining about, um, you know, a rib being out of place. And he knows how I feel about this rib being out of place thing. This is a very, very common thing that is wrong, in my opinion. This is a common thing that is wrong. Is someone will come in and say, "I've got a rib out." Now, sometimes you do that. If the way that the rib fits on the vertebrae, on the transverse process, the rib comes in the thoracic spine. Your thoracic spine has 12 vertebrae. It's between your cervical spine, which is your neck, and your lumbar spine, which is your low back. Your thoracic spine, and that's where all your ribs are. And they have a special way that they actually fit, and that there's a little groove that the back side of it fits on, and the rib comes around like a horseshoe. The rib is kind of built like a horseshoe, and in the back, it attaches in two places. It attaches to the transverse process, and it attaches to the vertebral body itself. There's two little grooves that rib fits in. And if that rib slips just a little bit off of that transverse process, what you'll get, that's what people call a rib out of place. Okay, so you'll get this rib out of place, and it feels like you're getting stabbed with an ice pick or something. You'll get like this lactic acid buildup. You get a trigger point that's around that little area, right? It's usually right between your shoulder blades, kind of down a little bit, maybe middle of the shoulder blade. Between your spine and your shoulder blade is usually where you feel those ribs. And you just, like, if it's literally not in the groove, it's not out of place like dislocated. It's subluxated in a chiropractic term. It's even subluxated in a medical term. Um, it's just a little bit off its groove. And when you breathe in, you suck that air in, and your rib cage expands. So that rib is moving all the time. And when you breathe out, your rib cage comes downward. So your rib cage rises and falls with every single breath. Well, you can just imagine if that dude's out of its groove, then every single time you try to raise it up, it's going to hurt because it's not in its proper position, and then you're going to end up with that trigger point area. Now, here's the other thing, is that sometimes you can have a different problem where the symptoms overlap exactly in the same place. And when you and that gets into your neck. And that's different. That is not a rib, but it will feel exactly like a rib being out of place. It'll feel the same. And if you've ever had a rib out of place, you'll think you have a rib out of place. You may have gone to a chiropractor sometime and they actually tell you that you have a rib out of place, and they're right in that instance, but they're not right the next time. And I think it's a misconception for you guys, especially you guys that get adjusted, because I think a lot of times that's what you think. Okay, well, if you've got nerve compression at C5 in your neck, C6, C7, C8, in those nerve roots that run through there. So the C5, C6, C7 area is what we're calling, that's the brachial plexus. Like you get this whole brachial plexus, C8, this T1 is these nerve roots that are coming down through this, the part of your neck right there. These are the major players in that brachial plexus right there. So what we're about to talk about with the article is very common to having the rib that feels like it's out of place, but if it stays in that position for very long, you'll also get the simultaneous numbness that starts down the arm, and then it'll come all the way down into the hand. And depending on which nerve you hit, it comes to which finger, right? So just remember this thing right here, that pain between the shoulder blade and the spine, discomfort between the shoulder blade and the spine. It's like sometimes you'll go to a chiropractor, they'll give you an injection into that trigger point. Yeah, I had to go get a shot in my back because I got this trigger point problem in my back. I'm like, dude, that is ridiculous. That is ridiculous that someone would do that to you. That's not going to solve your problem at all. It doesn't address it at all. So solving your problem would get proper function of your neck. And never, I'm not trying to get into that, but just remember that. Just remember that that's a thing. And you want to kind of remember that as we're going through this, because persistent neck pain and bizarre cranial symptoms are common sequelae of whiplash type injury. This girl was doing some sort of trick over and over and over again to where you actually jump backwards and land on your shoulders and the back of your head. It's a dance move. It's kind of like a kip up if you're laying on your back and you're going to flip up to your feet, except they do it from starting standing. So they stand up and then they jump backwards and land on the top of their shoulders and in the back of their neck, and then they kip back up. And I'm like, I told her, I said, I love you guys. I said, y'all are a chiropractor's dream. You crazy people that just jump backwards and land on your neck. I'm like, you guys are, that is just fantastic. Let's jack yourself up. Like, jack yourself up, and then we'll get you in. Come on, we'll make room for you, because you're definitely going to be in here with us if you're doing stuff like that. Okay? But now she doesn't have any idea that this article exists. She doesn't have any idea that, wait a minute. Listen to what this says. Since soft tissue injuries of the neck are rarely fatal, only few pathoanatomical studies of such injuries have been conducted. We reported on a man who had been extensively investigated after whiplash injury sustained in a traffic accident. He died at the age of 42 of a heart attack 12 years after the injury. The cervical spine was examined in great detail by cryosectioning, and the brachial plexa were examined microscopically. Yeah, those nerve roots that we just looked at, right? The results: there were marked isolated degenerative changes in C5, C6 segments, such as disc degeneration, uncovertebral osteophytosis, and zygapophyseal joint osteoarthrosis with subluxation. So he had those. What those mean right there That's exactly what I was talking about a while ago. Oncovertebral osteophytosis. And you're like, what did he just say? Like, what is he? That I don't understand what that means. Right. I didn't understand what it meant either, but I can tell you what it's how you spell it. Uncovertebral. Oncovertebral. Yeah, well, I know all those letters. Osteophytosis. Okay, I know all those letters too. Like, there's not a single letter in either one of those words I don't recognize. That's what gave me the confidence to say, look, just because I don't understand those letters doesn't mean I'm dumb. I mean, those words, I understand the letters. Just because I never heard that word before doesn't mean I'm dumb. I just need to read it and then break it down and see what they mean by that. And it's like, oh, okay. It's like osteo is bone. So osteophytosis, oncovertebral, that's just a place. Unco, whatever that prefix means of vertebral, it's just above or around or by or whatever that means. And then the vertebrae, we've got some bone growth. That's all that means. We got some bone growth. And what your medical doctor is going to call it is arthritis. What your chiropractor is probably going to call it is arthritis. They're going to say you got arthritis in your neck, right? The cervical spine was examined in great detail, and the results said there were degenerative changes at C5 and C6. I wonder if he had numbness and tingling in his fingers. Oh man, we're at the break. Hey, you guys stick around with us. We'll be right back. This is Life with Jason Clemmons, DC. We're going to take a little break for a second. We'll be back in just a minute. You guys stick around and we'll go over the rest of this one in the second half of the show. Thanks. So this is marked isolated degenerative changes in C5, C6 segments, such as disc degeneration. So I wonder if we could find how quickly we could find, I got so many of these. I got so many of these in my database here of C5, C6 disc degeneration. Look at this. This is C2, 3, 4, 5, 6. See that? That's C5, 6 disc degeneration. That's exactly what that article is saying. And the oncovertebral joints are around here. And so this whole segment is and look at this particular case where we've got a reversal of the cervical curve. And the reversal of the cervical curve, see how it's reversed? The red part is behind the green, and it's going in the wrong direction. So when they studied this, this isn't the 42-year-old person that died of a heart attack, but this person doesn't understand that findings in a person that was 42 years old that died of a heart attack are consistent with the findings of this particular cervical curve. And they don't understand that, look, these findings, you're saying, oh, come on. See, that's what I hate about you chiropractors, is you just make crap up and say that I'm going to die of a heart attack. I didn't make anything up. I'm just reading an article about the research that they found on a guy that 12 years after he had whiplash and reversed his cervical curve, he died of a heart attack. Maybe there's a correlation between those two things. Maybe there's a correlation between maybe having a reverse cervical curve, degeneration at C5, 6, and then having, some sort of issue down the road. So, and the question is, do you know it? Do you know it for yourself? Do you know what your cervical curve is? I bet you know what your cholesterol is. I bet you know what your A1C is. I bet you know what your blood pressure is. I bet you know those things. Do you know what your cervical curve is? And is it just as important? I think so. Okay, everybody, we're back. This is Life with Jason Clemmons, DC, and we're back from our break. Thanks for coming back and listening to us. We're breaking down the cervical curve and what happens after whiplash injuries and some of these cases that got carried on further down the road. And this young girl, she's been doing dance stuff since she was a little. She was little, and she's been going to whatever every town in America's got some sort of cheer dance team thing, right? Some sort of gym that teaches dance and and does cheer, and they just do it like crazy. I mean, it's almost it's as bad as football players. Like it's crazy that and no, the parents don't care. The parents don't even know. Well, let's just let our little girls jump on their back. She's not the only one in this dance routine. There's probably 15 or 20 of those girls in the dance routine, and all those girls are jumping backwards, landing on the back of their neck and pushing their heads forward until the point where this particular girl said, I'm not doing it anymore. I'll do it in competition, but I'm not practicing that move anymore. I got the move down, and all it does is jack me up. And I'm like, yeah, it does. It really does. So let's keep going right here. Let's look through the rest of this. Okay, so there's arthritis and degenerative changes that happened in this particular person. There's consistent with symptoms and clinical signs that were marked fibrotic perineural adherences in the brachial plexus. That's what we talked about the other night. These perineural, around the nerve, around the nerve, okay? Adherences, like stickiness. There was stickiness of soft tissue, fibrotic. So fibrosis, fibers, basically. There's fibers that are around the nerve that are adhering or sticking to, like glue, to the brachial plexus. There's like little spot welds along the brachial plexus of this person. Conclusion, the findings might explain the development of chronic symptoms. That's right. They might. They might not. It might have nothing to do with it, but I'm telling you that maybe there is. Maybe there is. These authors also note a considerable portion of the soft tissue injuries of the neck entail long-standing and disabling symptoms. The hypothesized source of such symptoms include disc injuries, and in that arthritis we're talking about, thoracic atlas syndrome, due to the scarring within and without the brachial plexus. So you injure that area right there, you're going to get some trouble. Here's another case. So this is a totally different person. A 30-year-old male sustained a whiplash in a traffic accident. His initial symptoms were neck stiffness and pain. In the following years, he continued to have neck symptoms with pain and also developed non-segmental or root paresthesia of left arm weakness. Sorry. So he also had left arm weakness. So we did that today. I was going to tell you about my new patient. I'm not going to. I may save it for tomorrow night, but he did a grip strength test with his right hand. His right hand was 28. His left hand was 40. His left hand is run by his right hemisphere. His right hand is run by his left hemisphere. He turned to his right during his step test. It's two things right there. Right cerebellum to left hemisphere. Left hemisphere weakness. Like make my right hand weak. You guys follow that stuff, right? So this guy, he started having troubles. 3 years after the injury, he began to suffer from headaches, dizziness, visual disturbances, right auditory symptoms, signs of brainstem dysfunction with transient dysfunction involving cranial nerves 9, 10, and 12. Right? We were talking about cranial nerves 6, 4, and 3 last night when we were talking about when I was trying to get that convergence thing. And I spent a couple hours between yesterday and today breaking that down. Thanks for letting me study and getting some more ideas about what we're going to do with that. But and all initial and subsequent x-rays of the cervical spine were normal. Treatment with physiotherapy rehabilitation did not help. 10 years after the injury, at age 40, he was disabled. Okay? His complaints were continuous neck pain radiating into the left arm, weakness of the left arm, numbness and poor coordination of the left hand, migrainous attacks of headache, vertigo, and fainting. He was having all kinds of trouble, and this was 10 years after his whiplash. It takes some time to develop these problems, and it's so important to address these problems at a younger age before we develop these problems in an older age. Because I'm going to tell you, when you get to be an older person and you're dealing with these problems, it really is hard to overcome some of these problems. And because you need a certain amount of brain power in order to solve these problems, and what's happening with this whiplash type stuff is it's decreasing your brain power. It's decreasing your brain power, and it's very hard to overcome that when you lose your brain power. You lose the energy to your brain. It's just it really is difficult. That was part of that new patient today. There was some really sad type stuff going on with that new patient. He wasn't really interested in anything we had in the office, and it was sad because there was a lot of things we could do to help. But that's a big deal. Clinical examinations revealed no neurological deficit. It was important. Head rotation to the left was markedly reduced. Forced rotation triggered severe vertigo and fainting. Head rotation to the left was markedly reduced. Forced rotation triggered severe vertigo and fainting. So, do you guys? I don't know how many today. There were more than 3. Can't remember all of them. Remember 3 off the top of my head. Stiffness. I got stiffness. Like, man, my body. One of my teachers came in today. She said, my body hurts all over, and I'm stiff, and her neck is stiff. I said, well, what'd you do? Work out? She was like, well, yeah, I've been working out and teaching little kids and doing all kinds of stuff. And yes, it's stiffness, right? This is one of the problems that this person had. Head rotation to the left was reduced. Can you guys do that? Can you rotate your head back and forth? Can you move just as easy to one direction as you can to the other direction? If you can't, you're changing neurological input into your brain. You're changing the power supply to the brain if you can't move your neck all the way in both directions. If you can only you start in one direction and you're like, whoa. And then if you force it into that direction, all of a sudden you push past it. And then now all of a sudden it's like, oh, I get vertigo or I get pain. That's what he was doing, fainting even. Neck and shoulder muscles were very tender to palpation. Just put your hand on somebody's, it's like, ow, that hurts. Don't. Like that. that happened a couple of times today. Ouch, like that hurts. Yeah, it's very pressure on C3 caused vertigo and fainting. Yes, there we go. Oculomotor tests showed signs of brainstem dysfunction. There was a positive left brachial plexus tension test. Cervical flexion extension films showed reduced motion at C5, C6 and reduced disc height at that level. So now, reduced motion. And one of the things that is like the gate theory, and is what Dr. Murphy is talking about right here. But one of the things that happens is how what the heck? Hang on. Oh, sorry. Let me replace this right here. Movement. We've talked about this before. Brain, nerve, hand. Smash your hand with a hammer. Bam. Okay? Smash your thumb with a hammer. Ouch. That hurts. One of my kids today cut the tip of his finger off with a saw right across the tip of his finger. Yeah, that was not good, right? Okay. We have injury, and the injury is going to send information into the spinal cord. And there's two types of fibers running through there. Remember your fast fibers and your slow fibers. And both of those things right there, the slow fibers are consistent, they're constant. The fast fibers only fire when you move. So now we're getting movement. Ow, ow, ow. I'm going to shake my hand. I'm going to shake my hand. What am I going to do? I'm moving my hand. What is movement doing? It's inhibiting, turning around and shutting the gate on the slow fibers that are being carried from the damage. That's that nociception we talk about that's being carried from the damage of the thumb. And it's like, ow, that hurts, but I'm going to shake it to make it feel better. That's the gate theory. If the fast fibers get there, it shuts it off. Now let's take it to the neck. Let's think about what goes on in the neck when you have a vertebra and a vertebra and a vertebra, and they're like not moving properly. If we have reduced motion, we did flexion extension X-rays. So we're going to take you in complete extension. We're going to take you into complete flexion. We're going to take an X-ray. We're going to measure the difference between those two, see if they're normal, not the difference between the two versus normal. And then, do you have reduced motion? If you have reduced motion, then you have the possibility of having this whole gate theory thing from the joints that are going, the nerves that are supplying the disc, the nerves that are supplying the joints, the nerves that are supplying the back of this whole thing. All this together, and there's nerves all around that thing. So if it's not moving properly, so you lose those fast firing inhibitory nerves, and all of a sudden here comes that stiffness, and here comes that soreness that comes from the neck, and it's just not moving like it's supposed to, right? Nothing's wrong with me. My neck's just stiff. Are you sure? Are you sure? Nothing's wrong with you. I never needed a chiropractor before. Well, that's an interesting statement. I never needed a chiropractor before. How do you know that? How do you know that you don't need a chiropractor? Well, nothing's wrong with me. Well, define what's wrong. Define that. There's nothing wrong with me. But just my neck's a little stiff. Okay, well, here's an article that says if your neck's a little stiff, then you might be having all kinds of problems that's going on that you don't need. Vertigo and fainting because your neck's a little stiff, right? These findings, there were no pathological changes in the brainstem or the spinal cord. The upper cervical spine down to C4-5 was normal. The C5, C6 segment level, the disc was narrowed and posterior osteophytes and annulus thickening. Annulus thickening is the backside that I got this question today. Stenosis. Can you help stenosis? 90-year-old female having pain in her right hand. MRI shows stenosis and bulging disc. And they can't figure out how they're going to solve that problem. And I'm like, well, maybe you're asking the wrong people. Well, she's 90. Yep, she has a nervous system. It works exactly the way it did when she was 60. Remember what we said this week? Age doesn't change the nerve supply. Age doesn't change it to those muscles. Those muscle spindles didn't decrease with age. They're still there. And when they're there and they're pressed on, then we need to address that situation, right? I think we'd like to have a shot at it. The disc was narrowed with posterior osteophytes and annulus thickening. The posterior osteophytes compress the anterior cord, epidural venous plexus. Yes, here we go. Now we're getting blood supply into this whole thing. Large uncinate osteophytes compress the right C6 nerve root. So now we've got bone spurs that are decreasing the blood supply to the disc, And we've got bone spurs that are compressing the C6 nerve root. And this is starting to cause problems in this person who had a whiplash injury 10 years ago, because the abnormal movement over time is what caused the degenerative process, along with abnormal chemistry. The abnormal chemistry and the abnormal movement over time caused a degenerative process that could have been solved, could have been resolved, could have been addressed had the person had somebody watching over their spine. Yes. The right zygapophyseal joint showed marked degenerative changes. The joint capsule was shriveled and the meniscal folds were retracted and fibrotic. There's the repair, the abnormal range of motion caused degenerative changes. Your doctor's just going to say it's arthritis. That's it. That's all you're going to get. That's all you're going to get. They're going to take an x-ray of your neck, and all they're going to tell you is, yeah, you just got some arthritis in your neck. Give you some meloxicam or something like that, right? Like, that's the answer to your problems. Give you some Celebrex. That's what you need. No, it's not. The left brachial plexus perineural was thicker, fibrotic, and markedly adhered to the nerve tissue. Discussion. The authors note that pertaining to chiropractic whiplash symptoms and disability, clinical and radiographic examination rarely yield objective signs of structural lesions apart from muscular tension and tenderness and restricted movement. That is a massive paragraph right there, or sentence. It's a massive sentence. Let me read it again. The authors note that pertaining to chronic whiplash symptoms and disability, if you have a chronic whiplash symptom or disability, here's what they're saying. They're saying that clinical and radiographic examinations, I'm going to take an x-ray of your neck. It's rarely going to tell me, it's rarely going to yield objective signs of structural lesions apart from muscular tension and tenderness and restricted movement. So think about that. You get analyzed, you go to your doctor, you tell your doctor, I think I had kind of a whiplash. My neck is really stiff. Your doctor takes an x-ray. What are the three things that your doctor's supposed to look at on the x-ray? Fracture, tumor, dislocation. That's it. That's it. Fracture, tumor, dislocation. They're going to look at cervical curve? No. They're going to do flexion extension? Probably not. They're just going to look at it. They're going to say to you, nothing's wrong, and they're going to give you an anti-inflammatory drug. Or a muscle relaxer, a painkiller and a muscle relaxer, and call me if you need me. What does that do? The painkiller and the muscle relaxer does not address whatsoever any of these things that we're talking about. And what it does is it sets you up it blocks the problem, the painkiller, and then the muscle relaxer makes your muscles turn off, and then we get some sort of anti-inflammatory steroid type of deal going on in there, and then we just knock down some of the inflammation, but we don't change the structure that's causing that problem. It's just so important. It's so important. It's like, look, no, that's not proper. That we need it to move. We need the neck to move through the proper ranges of motion. You need it to move. And so do I, because you're jacking up the world when your neck is not moving right. The authors reference the following theories as to the possible source of chronic whiplash symptoms. Occult disc lesion, so you're having a disc problem. Advanced spondylitic changes, you start to see bone changes. Fibrotic scarring, fibrous around the brachial plexus, scarring. Dysfunction of the joints. Cranial symptoms can be related to painful mechanical dysfunction of a motion segment in the mid-cervical spine. Painful mechanical dysfunction of a motion segment in the mid-cervical spine can give you cranial symptoms, headaches, eye strain, eyelid droop on one side. That goes all the way down into the upper thoracic area right there. At the C5-6 level, however, both myelography and cryosection showed unequivocal pathological changes with disc degeneration and uncovertebral osteophytes, bone spurs at the nerve root. There you go. Previous studies have shown that these joints injured in traffic accident victims and these lesions are impossible to detect on X-ray and also exceedingly difficult to diagnose with current available CT or MRI technology. It's really hard to diagnose this, especially afterwards after you get in a wreck. The late degenerative changes such as the bone changes of the and the decreased height of the disc are widely considered to be late problems of missed discoligamentous injuries. Yeah, there's some disc stuff going on, there's some ligament stuff going on, there's some abnormal movement stuff going on, and all that stuff together is causing some problems. X-rays of patients with significant symptoms after soft tissue injury of the neck show that they had all developed degenerative changes of the cervical spine 10 years later. 10 years after you had your whiplash, you started to develop the degeneration in your neck. And the degeneration in your neck started causing all kinds of problems. That's what the literature says right here. In 1993, a study showed traumatic bruising of the meniscoids in the C1, C2 joints in 50% of the specimens. This study supports post-traumatic time of service treatment to scarring in and about brachial plexus fibrotic repair. You got to do that. There's so much in that article right there that's just so important. You had a problem somewhere down the road, something happened to you, and you lost your cervical curve. You got some sort of whiplash, and man, what could it do? And how could it affect the rest of your life? So before we end, we got 4 minutes left, and I see that there's a question here. Lewis is asking, is there anything we can do to control restless leg syndrome? Yeah, so the number one thing that we do in our office, and I'm not, Lewis knows this, I'm not diagnosing anybody from the question. I'm just answering the question. The very first thing that we do in our office is magnesium. We just make sure that you get enough magnesium. That's the first starting point. It's the most simple starting point as far as I'm concerned, is magnesium. And how do you dose magnesium? First of all, don't go to Walmart and get your supplements. Okay? Go to your nutrition store. Nature's Tonic here in town. We got one inside of, we got one over at Sprouts. We got one inside Drug Emporium. We got Natural Health Market. We got lots of different ones in Lubbock. My favorite one is Natural Health Market. Brett over at Natural Health Market, and those guys inside of Drug Emporium at Vitamin World. But Brett's an expert in all supplements in Lubbock, and so you've got one of those places in your town. Now, I'm not talking about Herbalife shake place. I'm not talking about that. I'm talking about some sort of supplement shop where the guy knows what's going on, okay, or gal. Just go in there and say, I need some magnesium, and they'll get you the proper magnesium that you need. Or you can just look at the bottle, and if you want to go home and order it on Amazon, do that, whatever. But there is an advantage to having that person. So if you paid an extra $1 to have that person get you some magnesium, it would be really worth it for that. So how do you dose magnesium? In my opinion, I dose magnesium based on bowel movements. Like, take the magnesium until you get loose stools, till you start to get diarrhea. You don't have to go all the way to diarrhea, but you want to start to loosen things up. It's just really simple. You want to start, because some people say, well, I take magnesium, and I'm like, well, okay. Do you have any constipation? Well, yeah, a little bit, like kind of. Well, you're not getting enough magnesium, because that's the way your body gets rid of it. If you take too much magnesium, I promise you'll get rid of it. Like, it's very, very hard to overdose on magnesium. So you need that. That's the first one. The one of the products we use, Lewis, is Calm, CALM, Calm. it's been super good. You just mix it in some water before you go to bed, and then take it, and it helps. I take the magnesium in the evening time before you go to bed. That way, if you do have some sort of bowel issues, at least you could deal with it in the morning before you go to work. You don't want to take calm before you go to work in the morning and then have to deal with that throughout the day. The second thing that I would do is make sure that you're hydrated. Just the simple things is water. Um, and then we can get deeper and deeper into that. I mean, it could, you can get into the neurological aspect of restless leg syndrome, get adjusted, that type of thing. You could get into the sugar handling problem of restless leg syndrome because you're messing up all those nerves because of the high sugar intake. But to me, the simplest thing right off the bat, make sure you're getting enough magnesium and make sure you're drinking some water. You're getting hydrated. So, hey, that's the end of the show. I hope you guys enjoyed that. I'll be back tomorrow night at 6. And yeah, I'm gonna be back in a brain seminar tomorrow, so my brain will be ready to go. We'll probably talk about some brain stuff tomorrow night. You guys have a great night, and thanks for watching the show. If I can help you, I hope that helped, Lewis. And I'll talk to you guys tomorrow.